started it. And
Great.
we are recording the meeting, and you can get started anytime you like.
Good afternoon, everyone. I'm going to call the meeting to order. It's 2:04, and I will start the meeting by first asking for approval of the July 15th, 2024 minutes. Can I get a motion to approve, Dana? Can I get a second?
Second from Ben.
Thank you, Ben. All in favor? Aye.
Okay,
Any-
it's everybody.
Is that everyone, Cynthia?
Yeah, yeah.
Oh, okay, then July minutes are approved. Thank you, everyone. No one registered for public comment, correct, Cynthia?
Correct.
So with that, I'll move over to Singh to go over the Finance Committee report.
Hey, good afternoon. The Finance Committee met on August 12th. We spent a great deal of time reviewing our financial statements for the month of June, and there were also preliminary statements for the end of the fiscal year. We should at some point have the final statement after the audit. Work is still ongoing. This year, in meaning fiscal 24, our actual spending exceeded the annual budget by $5.6 million, requiring additional general funds appropriation. These high costs were for the call center, $2.8 million, fulfillment costs were $1.5 million, and that was due to the public health emergency unwind, and IDIQ resources were $1.5 million. Also, there was a budget amendment of $458,000, which was for COLA increases, which were not in the original budget. And because the state gave COLA increases, they had to be funded for. Also, during our last board meetings, we spent considerable amount of time discussing management's request for 4 IDIQ resources. And although our need was for less than a year, I would say, or short term, the contracts were done for 3 years. And it was explained that the government can cancel contracts for government's convenience. And there was a question during this meeting, will there be additional penalties or costs to be paid when that happens? And it was clarified that other than some minor costs like buying a laptop or something, there are now no additional costs to be paid by the government when a contract is canceled for government's convenience. Also, we had a brief discussion regarding the OLA audit that has been undergoing for some time. And now it appears that we are at the final stage of it. We should be having exit contracts next month. That completes my brief summary of our meeting. If Ben or Laura, you would like to add anything, please feel free to do that. Hearing none, thank you very much.
Thank you, Singh. Any questions for Singh? Okay, thank you. Next, we'll hear from Michelle and get the Executive Director update.
Thank you. I will be brief today because we have a abbreviated meeting. But first and foremost, I would like to announce that Governor Moore has appointed a new insurance commissioner, Marie Grant, who will take on that role in November. And we are so thankful to Joy Hatchett for filling in the interim and being at our meetings. And she brings a wealth of knowledge. And we're excited that Marie will be in that role because she also brings a wealth of experience and knowledge, having really been working with the exchange and with the state since the formation of the Affordable Care Act. So we're thrilled with that. The July data report is now available on MarylandHBE.com, and just again, some nice accomplishments that we're seeing. We ended enrollments in July with over 216,000 private plan enrollments. Although that's slightly down from June, it is still the highest July enrollment that we've had in the 11-year history of the exchange. Our new enrollments keep commanding a higher proportion of total enrollments. They were up 34% last month, again breaking an all-time record for new enrollments, which had been 32%. Our income-based Medicaid enrollments were 1.2 million at the end of July. That is now lower at any point in 2023 or 2024, but it is higher than what we had in 2019 when we were pre-pandemic. So again, getting more folks coverage. Also on the reporting front, one of the things that we have finally added, actually not finally, it was a very short request that I had made to our team, and they fulfilled it in a very prompt response time. As we're talking about the expanded tax credits and going to our federal delegation and really asking them to support the continuation of that, we realize that although we've done a great job of having state districts and data for all state districts, so our senators and our representatives can look and see what they have. We did not do that for our federal delegation. So Venkat and his team in short order got that put together, and we've now alerted not only our federal delegation, but our state-based marketplace, others who are interested in that same. So as we're trying to explain the importance of this, people can see exactly in their district how many people have coverage, what the coverage is, who's getting APTC, and that should really help us as we frame the story. Two announcements I have related to Aetna. We did get notice that Aetna recently had a leadership change. So Brian Kane, who had been their president, departed the company, and Karen Lynch will be the interim president of Aetna. And then second, Aetna will be leaving the small business marketplace in Maryland effective April 1st, 2025. So we've been working very closely with Aetna's team as they transition groups, which they'll do at renewal times. And currently in our small business program, we have 9 Aetna groups with 27 covered lives. Reminder that our September, we are in, let's see, our September meeting. Yeah, we're all still in August. Our September meeting will be a full 2-hour meeting. So we had changed that around a little bit. It'll be a full 2-hour meeting. And then finally, we are in the throes of gearing up for our 2025 plan year open enrollment. So a lot of training goes on behind the scenes, updating it, delivering it, system changes being made, call center hiring and training, our entire marketing plan for the open enrollment period. So there's a lot of work going on over the summer to get us prepared for rate finalization end of August, early September, and for plan shopping to begin October 1st and notices to go out October 1st. So I will stop there and happy to answer any questions.
Go ahead, Ben.
Thank you, Michelle. Thank you, Secretary. I know that we've had this discussion periodically before, but when people leave during the midst of the year, there are good things, i.e. you found a job and that job offers coverage, and there are also discouraging issues such as, I just can't cover the premiums anymore. Do we do any follow-up surveys or sample of people leaving to, obviously there are more than 2 reasons, but, the second concern is always one that I've had, which is you see people taking, chances with their healthcare because they can't afford the premiums. Maybe they had some urgent issue in the early part of the year that got resolved. That may be a factor too, but I think it'd be good to see if we can understand, why this is not something that's unique to Maryland. It happens in all the exchanges, but try to understand a little better what's happening, or perhaps you do.
We do an exit survey to find out, I'm calling it exit survey, find out where they've gone through, and we do collect that data. I suspect, and I'll have to confirm this for you, that we're only doing 1 ask of that after the fact when we know that they haven't come back. But let me check in with our team that does the surveying, and I can get back to the board on that.
Thank you, Michelle.
Mm-hmm.
I had a question just on the federal delegation and the maps that you said. Are those, have we seen those maps? Are those publicly available or on the website to take a look at? You're on mute.
Yes, they're in MarylandHBE.com
Okay,
under reports, and right at the very top, it's the dashboard. And so you can look at that for, you know, anything in the state, and it's quite comprehensive and nice to look at
thank you.
and get data. And very, you know, you can get lots of different cuts of data on it.
Okay, thank you. I didn't know that was out there.
Yeah.
Any other questions for Michelle?
I'll put the link in chat as well.
Okay, great. Thank you so much. Okay, next on the agenda, we're gonna hear about some policy actions, starting with the final 2025 young adult subsidy. Becca, are you on?
Yes, hello.
Michelle, we can see your IM. Okay, there you
Hi, everyone. Hi, everyone. My name is Becca Lane. I'm the Senior Health Policy Analyst on the Policy and Plan Management team at MHBE. And today I'm bringing the 2025 final young adult subsidy parameters to the board for their consideration. On this first slide here, at the July board meeting, staff presented the board with a recommendation on the 2025 parameters to revert to the plan year 2023 parameters, which are more conservative. So that was a conservative measure to remain within our available program funding. The board requested at that time that staff re-examine assumptions and reevaluate costs, considering a potential loss in young adult subsidy enrollments under that narrower eligibility parameter. So staff has worked with our actuary, Lewis and Ellis, to re-examine our assumptions and our actual 2024 program activity and revise the estimated program spend for the 2025 plan year. Based on our revised analysis, staff believe that the program parameters can remain as is with the expanded coverage parameters that were approved for plan year 2024. And during this presentation, I will review the program expenditures to date along with the new forecast, and I am including two options for the board to consider. On the first slide, or the next slide here, thank you. So here you can see for each year of the program, the funds available, the average number of enrollees receiving the subsidy, the average amount of subsidy per member per month, the total spend, and the amount of carryover funds at the end of each plan year. You can see in the first 2 years of the program, we underspent our budget, so $13.9 million and $13.2 million respectively of the $20 million available each year. I will note that although the table appears to have $6.1 million rolling over from 2022 to 2023, it's important to note that we were not able to roll funds over until legislation was passed in 2024, allowing us to do so. This year in 2024, we're on track for about 55,000 enrollees on average, receiving an average subsidy of almost $39 per member per month. Our actuaries project that this the total year cost for 2024 will be $24.5 million, which leaves over $8 million in rollover funds to help pay for 2025. Based on the actual data we have for 2024 so far, if we continue the parameters for 2025 that we currently have in 2024, so the expanded age parameters, we are projecting a similar number of enrollments in 2025 as we have this year in 2024, a similar amount of subsidy on average per member per month, and a total year cost of about $26 million. And this will leave us with more than $2 million left at the end of 2025. Next slide, please. So as a refresher on the parameter design options, here, this is an option. This is the estimates for applying the eligibility parameters from 2023, so the narrower age band, to 2025. So this is the original conservative recommendation. So under this option, young adults ages 18 through 34 would be eligible, and the maximum subsidy is available to those up to age 30. and those with incomes up to 400% of the federal poverty line are eligible. This is the same across both options, and lower incomes receive more subsidy. So under this option, we estimate a total cost of about $21.5 million, an average enrollment of about $46,000 if we were to implement this for 2025. So again, this is the more conservative option, and staff had previously recommended this when the total year cost projections had not yet stabilized, and an underestimation could have resulted in exceeding the budget. On the next slide, I have the parameters that we currently have in effect for 2024 that staff now recommend approving for 2025 based on the newly stabilized cost projections. In this design, individuals up to age 37 are eligible, and the maximum subsidy is available up to age 33. As I mentioned, the income parameters are the same under both options. Under this design, our actuaries estimate that that the average enrollment in 2025 will be similar to what we have this year, and they project that the total year cost will be about $26 million. Next slide, please. So MHBE held a public comment period on the proposed parameters, and we received one comment in support. Next slide, please. And here's a slide summarizing the parameter options for 2025 that I just described. As a reminder, option 2, to keep the 2024 expanded age parameters for 2025, is the revised staff recommendation. So all that being said, I would like to request a motion to finalize the 2025 young adult subsidy parameters.
Dana, are you making a motion to approve?
Oh,
Or
sure, I'll
or
do
did
it.
you have a question? No. Does anyone have questions?
I have a question.
Go ahead, Singh.
If we can go back to the slide where we had the 3 years with the cost starting with one before. Yes. So in this one, we started with 22 and we had carryover fund 6.1 million, then next year 12.9. And then the cost started catching up. And in fiscal 25, it's estimated to be $26 million at 54,000 enrollees. What happens after 25?
So we don't know yet. So the current legislation authorizing this program sunsets at the end of 2025. So we would have to see new legislation allowing us to continue the program and allocating more budget. So we do not know yet.
And the funds available in this one, except for the ones that are being carried over, is still $20 million each year. Because it's just the difference that is being added to that each year, what's available, carried over. So where I am, that if we were to ask for an extension, after 2025, our base would have reached, as this says, $26 million. We will be asking for at least $26 million plus inflation at that time, a significant increase, right? And this, if we go with this option 2.
We won't know until that legislation happens how much budget will be requested. But no matter what the budget ends up being, if the program were to be extended for 2026 and beyond, we would continue to evaluate and set parameters that keep us within budget. So it just depends on what ends up happening in the next legislative session.
And Singh, I can add a little context here. So this was a pilot program for 2 years, and then it got extended for another 2 years. And the original, it comes out of the reinsurance fund. So this is all part of the reinsurance funding. And the intent is to make, the market, stabilize the market by getting more young people enrolled. So when we went back to the legislature and asked for that rollover, we saw this huge jump in people. Part of the huge jump in 2024 was because of the public health emergency unwinding. So a lot of folks that had been on Medicaid and no longer were eligible qualified for a private commercial plan. So as Becca said, we'll have to monitor and see how it plays out continuing. But it is likely that there will be legislation to continue this. And it will have to be a study to see what will that funding need to be. And I suspect it would still come out of the reinsurance pool of money.
Thank
So
you.
Michelle, just a follow-up question to that, since we don't know what's going to happen, is it the kind of, I don't know if these dollars are in a special non-relapsing fund and whether or not it makes sense to be conservative, you know, to Sing's point, even if you come in with another $20 million out of the reinsurance fund and having some rollover from 25 into 26, so you can keep as many young adults in the program, as opposed to having a cliff where a bunch of people will fall off because you just don't have enough money to continue to fund 54,000 plus young adults. I mean, what was the discussion of 1 versus 2, other than the obvious on the age, but given that
Yes,
2 will
yes.
really eat up a lot of the money, you won't have rollover dollars
Right.
should it get passed, or a lot of
So,
rollover.
and Becca, I don't know, and this may be difficult. We could pull up that slide that shows the spend on the reinsurance, but I can talk through it. So right now, the reinsurance program goes through 2028. So if we, even, the way it stands now, even if we have to devote more funding to the tax credits because of the expansion of ARPA, we still project that there will be funds in the risk pool or the reinsurance pool by the end of 2028. So there's lots of money in that pool. This was just, again, a small pilot to see how it would work. But we do have, and I think you've seen it in others, and we can certainly share that. I can put that in the chat as well. The slide that shows the reinsurance money and the projections throughout 2028. So right now we're really solid through 2028. The decision would be, and that's for the entire reinsurance program, what happens after 2028? Because right now we only have authority through 2028.
Thank you, Michelle. Any other questions for Becca? So the motion on the table was to approve option 2 as the final 2025 young adult premium subsidy parameters as presented. Can I get a motion to approve? Dana, second? Ben, all in favor? Aye.
Aye. I kind of say Laura Crandon is on the line, but I don't see her camera on, so I'm not sure if she voted in the first round but I see all your hands, so you can put them down. Thank you. But I'm not sure about Laura.
And Laura, can you put your camera on, please, for the board meeting?
Looks like Laura raised her hand. I see on the screen.
Can you see me?
Yes, hello.
So do we have the vote captured? Cynthia, is that everyone?
Yes, as long as Laura Crandon said yes.
Yes, I had a raised hand in the
Okay.
reactions.
Okay, thank you. Everybody's good.
Okay, so the motion carries. Thank you all. Next, we're going to hear about Medicaid special enrollments. Becca?
Thank you. Moment here. Okay. So I am bringing a second item before the board today. This is the loss of Medicaid special enrollment period regulations. So Today, we are seeking authorization from the Board of Trustees to submit a regulatory change allowing a special enrollment period for loss of Medicaid coverage to be extended from 90 to 120 days. We are making this request because during the public health emergency unwinding, Medicaid expanded its eligibility reconsideration period from 90 to 120 days. Medicaid has chosen to make this a permanent change, and federal rules align the loss of Medicaid special enrollment period with the reconsideration period. And as this is now a permanent change, we are seeking to update our regulations to align with that 120-day reconsideration period. And for those who are unfamiliar, during the reconsideration period, an individual who has been terminated from Medicaid may submit documentation showing their continued eligibility to have their Medicaid coverage reinstated, or they may still be determined ineligible. So by aligning the loss of Medicaid SEP with the reconsideration period, consumers can enroll in a private plan whenever they are determined ineligible for Medicaid, which reduces gaps in coverage. Because if that reconsideration period is longer than the SEP, they may find out that they are ineligible for Medicaid too late after their SEP has closed. So that is the background. On the next slide, we have here the exact language we're proposing to update. So it's just changing this number from 90 to 120 days. On the next slide, we have a summary of the feedback we've received from stakeholders. We received 2 comments in support and 1 in opposition. The opposing commenter is concerned that a longer SEP could lead consumers to wait to enroll in private plans, which could lead to gaps in coverage. They suggest that enhanced outreach to those terminated from Medicaid would be suitable here, and that we should rely on existing retroactive termination processes for those who are eventually determined eligible for Medicaid after all. So we agree that this population should receive lots of support for enrolling in private plans as soon as possible. But this longer SEP is intended to be part of a complementary suite of ways to reduce gaps in coverage, and not intended to replace a robust outreach strategy. So on the next slide here, we have a timeline for the regulatory process. We have opted to file this change as both an emergency action and a proposed action. This just means, bottom line, that if the emergency status is approved, we will be allowed to implement the change earlier. We'll still follow the full regulatory process and bring the final action to the board for a vote in January. So now I would like to request a motion for approval of the proposed regulations and authorization to submit them for review and publication.
Thank you, Becca. Any questions for Becca? Okay, I have moved to approve the proposed regulations as presented and authorize the exchange to submit them as both the proposed action and an emergency action to the Joint Committee on Administrative, Executive, and Legislative Review and to the Division of State Documents for publication in the Maryland Register as presented. Can I get a motion to approve? Maria, thank you. Can I get a second?
Second.
Thank you, Singh. All in favor? Aye.
Aye.
Okay, thank you.
Is that everyone, Cynthia?
Yes.
Okay, motion carries. Thank you, Becca.
Thank you.
Next, we'll hear about procurement actions. Sherelle, I think you're on as the procurement manager to hear about small business premium aggregation and billing solutions.
Correct. But I think Mimi is going to do a brief introduction about the program prior.
Yes. Hi. Good afternoon, everyone. Thank you for having me here today. My name is Mimi Haile-Gabriel, and I'm the Small Business Program Manager at MHBE. My colleague Sherelle Green and I are here to present the request for your approval on a small business premium billing and aggregation solution service contracts.
Mimi, can you go on camera? I don't see you. And so
I-
the board, are you on camera?
I am
I
on
see.
camera.
Oh,
I-
there you go. Sorry, it was just me.
Okay.
I'm sorry.
No worries. All right. So today we seek your approval for a vendor contract to deliver premium billing and aggregation solution services for our small business program. Since 2014, we have offered various solutions to enhance the health coverage options for small businesses in Maryland. Today's direct-to-carrier enrollment process was approved as a temporary measure by the MHBE Board of Directors in 2018. In 2020, we introduced a two-phase shop portal, which included eligibility determination and coding features. We then rebranded to MHC for small business. Next slide, please. Maryland is home to close to 640,000 small businesses. That represents about 99.5% of all businesses in the state. According to the Agency for Healthcare Research and Quality, 78,000 of these small businesses employ fewer than 10 employees or 10 people. This also happens to be the market where employers find it difficult to offer health insurance. Among the 78,000 businesses, about 48,000 do not offer health insurance, and 24,000 have fewer than 5 employees. Businesses with fewer than 5 employees often face significant challenges in providing health insurance coverage, which is why we've identified them as our primary target audience. With this MHC for Small Business one-stop shop enrollment portal, we estimate about 100,000 uninsured Marylanders will be able to easily obtain health insurance coverage through their employer. Next slide, please. Looking ahead, Maryland Health Connection for Small Business Maryland Health Connection for Small Business has several exciting developments in the pipeline. We aim to address the needs of our expanding small business broker community who have expressed a strong desire for a streamlined one-stop shop solution. Additionally, we plan to enhance the support for employers through targeted outreach, education, certification programs. Our pathways to coverage on the right-hand side, that image that you see, will connect employers with brokers to explore traditional health plans or individual coverage health reimbursement arrangements, also known as ICRAs, which allow employers to contribute to their employees' marketplace coverage. This is projected to roll out in FY 2026. And we will also help employees access individual plans on the exchange with or without subsidies if that's the path the employer chooses to go. Our approach is inspired by successful models from DC HealthLink or DC Health Benefit Exchange and Massachusetts State Exchange. While these states have different landscapes, their experiences have led to lower uninsured rates and increased coverage within their small business programs. And we aim to adapt to these successful strategies to fit our context and achieve similar outcomes. And now, with this background, I will pass the virtual mic to my colleague Sherelle to go over the procurement process.
Good afternoon, Madam Secretary. We put out the request for proposal on June the 17th, which is approximately 40 days. We did a pre-proposal conference on June the 26th where we had 7 potential responders attend, and we addressed 20 questions that we received. The RFP closed on July the 26th, 2024. Next slide, please. We received 2 proposals. The evaluation period for the proposals was from July the 29th, 2024 to August 1st, 2024. After that, we opened up the financials on August the 2nd through August the 5th, 2024. We had to do some negotiations. We did get our best and final offer on August the 5th, 2024, and the selected vendor was NFP Health Services Administrators, LLC. Second slide, next slide, please. The Evaluation Committee recommends awarding the Small Business Premium Aggregation and Billing Solution contract to NFP Health Services. Offerors produced strong technical and financial proposals that demonstrated an understanding of the RFP. Offer had understanding of the Affordable Care Act. They have worked with state-based marketplace since inception of ACA. Financial and technical proposals demonstrated to the evaluation panel that ability to provide the state the best value for the services requested. Next slide, please. We did have an MBE goal. The vendor has agreed to meet the MBE goal of 10%. They do have a African-American owned business. Next slide. Contract total for the 5 years will be $2,480,392.22. And the not to exceed amount for FY25 will be $413,399. The appropriate and the preparations and approved FY25 budget breakdown per year states is 100%. Okay, next slide, please. MHBE requests the board's approval to award the contract to NFP Health Service Administration LLC in the amount of $248,392.22 with a 100% state participation to procure the small business premium navigation and billing solutions for the period from September 1, 2024 through August 31st, 2027, which is actually the base period for 3 years. And then we do have the 2 1-year option as stated below. Next slide, please. That might be it.
Thank you, Mimi. Are there any
That's it.
questions? Thank you, Mimi. Are there any questions? Go ahead, Singh.
Since the contract is over 2 different fiscal years for the exchange, fiscal years are July 1 and the contract is through September 1. The amount that was given for fiscal 25 before, was that for a 9 or 10-month period or for a 12-month period?
It was actually for, I believe, the 10-month period, and we put the balance at the end of the contract option periods.
Thank you.
You're welcome.
Ben?
Yes, Ben.
Thank you, Sherelle, Mimi. A question on the bid. I did notice that they made a rather substantial reduction from their original offer to the best and final. Did we have to change any requirements, or was it there would be, I don't know, I think it's $650,000 drop in price, maybe a bit more.
Actually, no, we did not have to adjust the RFP scope of work at all. And it was roughly almost $1 million in reduction. Their objective is to do the work with MHBE because they can appreciate the services we're trying to provide.
And did we talked, I assume, to Massachusetts and DC and California and New Mexico. I think all of them have used NFP before, right?
You would have to ask Mimi about that. I'm not sure. I do know that the program did do research almost a year ago regarding this, and they did reach out to those agencies for some ideas and support. So I wouldn't be surprised if they didn't get some feedback.
Oh,
Yes,
okay.
that's correct. We did get some feedback from some of those states. And yes, we've been in discussion.
Yeah, I think that's a good job, to get that much of a savings. I wanted to be sure they didn't short us in any way. So that sounds like pretty aggressive competition.
Yes, we went back and forth for a couple of days, as you could tell by the slide, but it worked out. And their main objective is they appreciate our company and they want to do work for us. So that was good for us, and always get that back up, right?
Absolutely.
Ben, I was with you on that. I was wondering, that was a big decline. So I was worried about scope or subbing out to a subcontractor that maybe they hadn't worked with before based on the amount of savings that they were generating over the 5-year period. So thanks. Any other questions for Mimi or Sherelle? Okay, then I move to approve a contract award to NFP Health Services Administrators LLC in the amount of $2,480,392.22 with 100% state participation to procure small business premium aggregation and billing solution for the period from September 1st, 2024 through August 31st, 2027, with 2 option renewable periods of September 1st, 2027 through August 31st, 2028, and September 1st, 2028 through August 31st, 2029, as presented. Can I get a motion to approve?
So moved. This is Ben.
Ben, thank you. Can I get a second? Thank you,
Second,
Dana. All in favor? Aye.
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 I,
Okay, I have everybody. Thank you.
You have everyone? Okay.
Yeah.
Motion carries. That's the last agenda item, Michelle. We finished early and there's no closed session meeting anticipated. Do I just wrap it up?
That's right. Take a motion to adjourn. We're good to go.
You guys were incredibly efficient today, so can I get a motion to adjourn?
So moved.
Thank you, Singh. Second. All in favor? Aye.
Aye.
Well, thank you, guys. Enjoy the rest of summer and happy Labor Day. And for those of you who have kids going back to school, good luck.
Thank you.
Thank
Bye.
you.
Bye-bye.
Bye.